Hi, supervisor. Hope you're having a good evening. I've come to you today with a client I'm currently working with as I need some help. Amy, a 19-year-old Aboriginal woman of Banuba descent, initially sought support for anxiety and depression, but has recently disclosed that she has been self-starving again, raising concerns about a potential eating disorder. Although we have built a strong therapeutic relationship, I recognize that treating eating disorders requires expertise beyond my competence. Amy has expressed her reluctancy to seek another professional and insists on continuing therapy solely with me. Therefore, the ethical dilemma I have identified is that as a psychologist, how can I respect Amy's right to choose the next step while also ensuring she gets the safest and most effective care for her eating disorder? Referring to General Principle A in the APS Code of Ethics, specifically A.3, informed consent, it emphasizes Amy's right to discontinue treatment. However, it is essential that I ensure Amy is fully aware of the potential risks associated with her choices, such as the dangers of self-starvation and the necessity for specialized care. Additionally, 8.5 confidentiality requires me to respect her privacy, but 8.5.2 disclosure of confidential information allows sharing information when there's a serious risk to her health, ensuring she receives proper care. These principles guide my decision making, balancing Amy's autonomy with my duty to safeguard her well-being. Given my strong sense of perfection, I may be inclined to prioritize Amy's trust and our therapeutic relationship over ensuring she receives the most competent care. I also feel a sense of personal responsibility for her well-being, similar to how I would care for a family member, which could cloud my judgment and lead me to make decisions that may not align with the APS Code of Ethics. This could result in a values trap where my desire for perfection in this therapeutic relationship could interfere with my professional duty to act in Amy's best interest. Recognizing this, I remind myself that my professional responsibility is to provide Amy with the best care. So, with research, Amy's case highlights the ethical tension between respecting autonomy and ensuring beneficence. Sharp discusses similar dilemmas in research ethics where patient values may conflict with professional responsibilities. They emphasize that ethics consultations help clarify decision making and explore alternative approaches that respect autonomy while mitigating harm. If Amy's self-starvation poses an immediate risk, intervention may be necessary, but must be ethically justified to avoid paternalism. Additionally, as an Aboriginal woman, Amy may face cultural barriers in healthcare, such as the lack of trust or negative past experiences with services that do not respect her cultural identity. Kermayer highlights that cultural safety in mental health requires recognizing power imbalances, historical trauma, and systematic barriers that shape a patient's experience. In Amy's case, these factors may influence her reluctancy to speak to people in specialized care, raising ethical concerns about the balance of her autonomy while providing duty to prevent the harm. As a psychologist, I have the right to practice within my scope. As per B.1.2, competence in the APS Code of Ethics, which ensures my professional conduct aligns with ethical standards. This aligns with Wallace, who stresses the significance of professional competence, especially in cases like eating disorders. My commitment to maintaining Amy's trust in our therapeutic relationship could hinder progress as well. As Gottlieb notes, personal values influence ethical decisions. As a psychologist, my limited understanding of the cultural factors, such as the economic barriers in healthcare, is underscored by another article by Kermayer, in which he says it creates a gap in practice. My Western training may obscure cultural expressions of distress and influence of historical trauma on help-seeking behaviors. So, I have two options here. One option is to continue working with Amy, respecting her preference to stay with me. Alternatively, I could introduce a specialist while maintaining my role, ensuring Amy receives proper care while preserving our relationship. Evaluating the consequences of the two options, continuing to work with Amy despite my lack of expertise would immediately respect her preference to stay with me in therapy, ensure she feels heard and understood. However, this option may not provide appropriate care for eating disorder, risking her health and well-being, and conflicting with my ethical duty to practice competently. This could lead to harm, and if Amy's condition worsens, could cause her to lose trust in me, undermining the entirety of the therapeutic relationship. On the other hand, introducing a specialist that honors her cultural background while maintaining my role would ensure Amy receives the necessary care while I continue to offer emotional support. This collaborative approach promotes transparency and is likely to strengthen her trust and engagement within me, while aligning with the ethical guidelines. However, she may resist the referral, viewing it as an infringement of her autonomy, which could decrease her engagement and increase distress, therefore leading to disengagement with further help. Ultimately, I've decided to introduce a specialist while maintaining my role in her treatment. I'll explain the need for specialized care, reassure her of her continued support, and collaborative approaches with the specialists. Furthermore, by fostering open communication, it allows Amy to remain autonomous in her decision making. This approach addresses the ethical dilemma of respecting her right to choose her path while also ensuring that she receives the safest and most effective care for her eating disorder. I welcome your thoughts and on any other additional ethical considerations or alternative perspectives that may further guide my decision making. Thank you.